I'm Dr. Chandan Chaudhari. I'm consultant and nephrologist and renal transplant physician at Wockhardt Hospital, Mumbai Central. I work here for almost last more than 10 years, and as a nephrologist, we deal with kidney diseases, recurrent kidney stone. We take care of dialysis patients, hemodialysis, peritoneal dialysis. We do renal transplants, and of course the post-transplant care. The, the most common kidney diseases, I would suggest all the people with the diabetes, even if they start working on themselves for checking the protein in urine and monitoring their kidney function, I think we will be able to prevent more than 30-40% of the future dialysis patients, or we may be able to delay them. So definitely the diabetes is major killer. Apart from that is the people who are having hypertension, then the people who are obese, people who need to take regular painkiller medications. These are the person at risk of kidney diseases.
What causes kidney stones and how can they be prevented?
Kidney stone. See, the kidney stone, it can't happen overnight. We have to understand the concept that there can be a crystalluria. So what do you mean by crystalluria? It can be microcrystals which are joining together and then forming a stone. So we need to understand why there can be a crystalluria. So there can be a less liquid component, means a person who may not be having a adequate hydration, and the other side, he may be losing the substances more into the urine, which can result into the crystal formation or stone formation. So the most common reason for stones are they are calcium based stones, and sometimes they are uric acid based stones. So the stone prevention, as for a normal people, I would suggest a good hydration is important. But definitely for people who are getting repeated kidney stone, they can get checked for their blood test, and there are tests for the 24-hour urine workup. There are tests for the parathyroid. There are tests for the sonography, and then we can have a preventive medications to minimize the stone recurrence.
How does high blood pressure impact kidney?
Blood pressure, see, the blood pressure, I would suggest if it's a long standing hypertension which is uncontrolled, definitely it itself can have effect on the kidney. But in case of young hypertension, I would like to emphasize a point that any patient who is young and developing a blood pressure should see that whether he has got blood pressure at young age because of kidney. Because the kidney and hypertension, it can be cause and effect, or it can be the effect and cause. So what do we mean by this? Young hypertension, many of times the cause of hypertension lies into the defect in the kidney function, or problem with the arteries supplying the kidney, or sometimes the glands which are above the kidney is known as adrenal glands. They can be having a hyper functioning or excessive hormone secretion. So all these things can cause young hypertension. So young hypertension has to be evaluated, and on the other side, all the people with the blood pressure should monitor their kidney function, I would suggest at least once a year.
What is chronic kidney diseases and how is it diagnosed?
See, whenever this panic is created, kidney disease. So other than the kidney disease, there is always a panic that kidney failure. So what we need to understand, any person who suddenly comes to know that his urea levels are high, his creatinine levels are high, it does not mean this that his kidneys are failed. So the kidney shutdown, it can be a acute kidney injury, which is most of the time reversible, or it's a short term in onset. On the contrary, chronic kidney disease is a type of permanent loss of kidney function, which may not be reversible. So what we need to understand when we are saying about the chronic kidney disease, it doesn't mean that it's completely 100% function is lost. So the kidney may have lost 20% of function, 30% of function, 40% of function, 50% of function. So when you have lost 20%, 30%, it doesn't mean kidneys are failed. And of course, it doesn't mean kidneys are normal. So we need to understand that kidneys may be weak by some grades. And these are the people who may not have a reversal of the kidney function back to normal, but definitely these are the people who should be worked up, who should be treated to prevent the onset of dialysis or delay the dialysis and stabilize their kidney function.
Can kidney disease be reversed if detected early?
This is a very important question. See, the kidney disease, whether it can be reversed, we need to get into the cause of kidney disease. So, what is the cause of kidney disease? If it is autoimmune kidney disease and treated on time, it may be reversible. If it is an obstruction into the passage of urinary tract, it and if you treat that obstruction, it can be reversible. And if it is a diabetes and it's a start of kidney disease or a start of losing protein in urine, I won't say the word reversal, but I would definitely be able to say that we can delay the end stage kidney disease. Reversal may not be a completely right word, but the right word will be we can definitely delay the end stage kidney disease, or slow down the rate of loss of kidney disease or rate of loss of kidney function.
Myths and facts. Is it true that drinking too much water can overwork the kidney?
See, anything in excess is bad, okay, but it does not mean that it is going to overload the kidney. In fact, it may cause a condition called as hyponatremia, where patient may have low sodium and more water comparatively. So definitely it is not advisable to have excess water.
Can you survive with just one kidney or is that a myth?
Yes, this is a very good question because this helps you to promote the organ donation for country like us, where there are so many patients who are undergoing dialysis and there is so much of shortage of organs. Okay, so if someone is willing to donate, this is something which can help the people to understand that if if they are clinically fit, they are medically fit, they are not having high blood pressure, they are not having diabetes, they are not obese, they are not losing protein in urine, their kidney functions are normal, they can be taken up as a donor provided they are willing. It's not a compulsion, it's a choice, it's a willingness. Okay, and yes, in that case the patient can live with the one kidney. Okay, so it's not that if patient has a one kidney, that means he is going to have a problem. It happens in many patients that at age of 50, 60, the first time they get abdominal pain, they do a sonography and then they come to know that they are having a single kidney.
Does consumption cranberry juice really prevent kidney infection and stones?
See, these cranberry juice supplements, they may have a role in prevention of urinary tract infections but not stones.
Are kidney disease always accompanied by pain?
No, it is not necessary that the patient with the kidney disease will have pain. It some happens many a times that patient do not have even a symptoms like headache, blood pressure also, or they don't have even a swelling over the feet, and randomly they do the blood test and they found to have a high creatinine level. So pain is not a mandatory criteria to have a kidney disease. Yes, if someone is having pain at flank, it can be because of muscular pain or it can be related to the kidney. It can in kidney it can be because of stone, but having pain is not the mandatory criteria to have a kidney disease.
Is dialysis the only treatment for kidney failure?
For kidney failure, first we need to understand what are why we are doing a dialysis. Dialysis, many times people say I won't do dialysis. So we have to understand dialysis is advised to remove the excess toxins which are present in the body and which are not allowing the patient to function normally. Because of high urea levels, he is not able to function properly, his appetite is down. Because of high potassium level, his heart rhythm is getting irregular. Because of high acid in the blood, he is always having nausea, vomiting, or poor appetite. So, in such cases, the people are advised dialysis. Or if he's having a lot of swelling over the body, breathing difficulty, they are advised dialysis. So, first important thing we need to understand why the dialysis is advised. So, dialysis is only treatment. What it means? It means that we need to take the toxins out. So dialysis can be of two types: hemodialysis and peritoneal dialysis. So peritoneal dialysis, where the catheter is placed into the abdomen, and the dialysis can be done at home and it doesn't require any special machine. Okay, so we need to understand the option is hemodialysis or peritoneal dialysis. And if someone doesn't want to go for a dialysis, there is a concept called as preemptive transplant, where people, when they understand that now the kidney function has gone to the stage where there won't be a reversal, so they straight away go for a transplant. So it can be a preemptive transplant.